Hello everyone, myself Himani Sharma from RPIIT campus. In today's class, I discuss about the antithrombin third, here are the serine protease inhibitor. Next is used heparin and next is the thrombomodulin thrombin binding protein. Thrombomodulin thrombin complex activates the protein C. Activated protein C and S, plasmin, dicumaril and warfarin that inhibit action of vitamin K. Anticoagulants in vitro are EDTA, oxalate, heparin, sodium citrate, sodium chloride, potassium oxalate. Next are the characteristics. It must not alter the size of the red cells. It must not cause the hemolysis. It must minimize the platelet aggregation and it must minimize disruption of the staining and morphology of leukocytes. It must be readily soluble in blood. These all are the characteristics of the anticoagulants that used in vitro and in vivo. First, discuss the EDTA. It is the ethylene diamine tetraacetic acid. Best meets the above requirement and it is used most frequently the tripotassium salt K3-EDTA and the disodium salt sodium 2-EDTA. Calcium EDTA is not used as an anticoagulant, but in the treatment of the lead poisoning only, it is used in the treatment of the lead poisoning. Next is the mode of action. It forms insoluble calcium salt by chelation. Next is the uses. What are the uses of EDTA? Making a blood smear for cell morphology studies, test for the microfilaria, perform cell counts, 1. Plasma protein, fibrinogen, glucose, determination of Combs test. Next is the EDTA preserves the staining and morphological characteristics of leukocytes. Next is the disadvantages. Excessive concentration of EDTA will cause shrinking of RBCs and erroneous PCV, MCV and MCHC results. Next is the oxalate, a mixture of dry ammonium oxalate and potassium oxalate in the ratio of 3:2 is used. Mode of action, it combines with calcium to form insoluble calcium oxalate. Potassium oxalate alone causes red cells to shrink. Ammonium oxalate alone causes red cell to swell. Used together, little cellular desorption occurs in the first hour after collection. And next is the uses. What is the uses of oxalate? The oxalate mixture may be used for hematological sedimentation studies. Potassium oxalate alone is valid for immediate glucose determination. Ammonium oxalate is used as a diluent in some method for manually counting there are the WBC and platelets. Next is the disadvantages. It does not prevent platelet aggregation in vitro as effectively as EDTA. Next disadvantage is the poisonous and should not be used for blood transfusion. In today's class, I discuss about the anticoagulant used in vivo and vitro, their characteristics and the features of EDTA and oxalate. Thank you for watching.